Hey, I hope everyone's doing alright out there. Just wanted to make a video or a series of videos just going covering, I suppose, pilonidal cysts and pilonidal sinuses and recoveries just for, I suppose, primarily for people that are going through the same or are about to go through the same. Um, there's a series of videos there on YouTube from other people that have went through different success stories and their follow-ups after surgeries, etc. I suppose it's still probably an area that people are, I suppose, uncomfortable to talk about for obvious reasons. But I just wanted to make a series of videos to try and address some of the misconceptions, and just maybe some tips for after you've had surgery. So, in my case, I've actually had two surgeries. I underwent my second surgery about 3 months ago, and I'm still out of work at the moment. With the first surgery, common procedure if you've actually gone for full surgery with these or going for them is that your surgeon will do something called an incision or an extraction with a primary closure, which means they extract out the sinus and basically stitch it up. The healing times for these tend to be a lot lesser than other methods. Obviously, by stitching it closed, and it helps it heal quicker, but the recurrence of them can be higher with that sort of procedure. The procedure with the second operation I had was 3 months ago. When they went back in to check the work from the first surgery, like the second operation was initially only meant to be a very superficial one, just to make sure the first one had worked. But when they went back in and checked, basically they injected a dye back into it, and they seen that the part that they extracted had actually grown a new one with the bottom part. So they actually just went ahead and cut out a large portion of the area, basically, and left the wound to heal open this time. The difference is with that one, obviously, it's a lot longer of a healing time. Obviously, I'm still, like I said at the beginning of the video, still out of work 3 months later. Now, mine has been bothering me for, I suppose, nigh on maybe 18 months to 2 years. The first surgery I had was in November of 2018, so I had about 6 months of a gap, I suppose, between my first and second surgeries. I had the second surgery on the 20th of June of this year, 2019. So we're just about the 3 month stage. It is progressing well, but what I will say is, if it's been extracted the way that the second one has, and you're going in for the surgery, it's just, I suppose, just a few things to be aware of. Maybe just a few tips as well that have for people from my experiences. I suppose you can try get used to lying on your stomach. That's helped me a lot. Logic will dictate that. Like, you can't really lie on your back as such. Maybe some people can, but I've found that I can't. Obviously, with all these dressings and all in there, and as well as that, if it's leaking, which it will do, it's not going to be ideal. For obvious reasons as well. So if you can get used to it, and it is very hard because I never really used to lie on my stomach. So at the moment I am, as I'm speaking to you. Try get used to that. You can eventually turn onto your side after a while. It all depends. Like, talk to your nurses and your doctors, and they'll kind of let you know what you can and can't do. And in terms of sitting, like, I haven't sat in 3 months since I've had the operation. There's still part of the wound open. Now, in my case, I suppose psychologically it's more harder than pain. Like, the pain that's associated with these is usually in the stages where it actually becomes a cyst before you go in for your surgery. That's obviously what prompts you to go. Look, it would mostly manifest itself as a lump somewhere around the tailbone area, which increases in size over time as it gets worse. They burst as well sometimes. That can be probably, I'd say, the most painful part of it. Is that you really knew there was a problem then. prompted me to go to the doctor. Like, I never would have went to the doctor. I thought it would just go away or whatever, but they are common, but not so common that you would know. I would need to go to the doctor over this kind of fairly quickly. Especially men. Like, men don't really tend to go to the doctor unless their arm is falling off or whatever. But I've been fortunate at the hospital that I've been here in Ireland that they're actually tending to do a lot of these now. They are a common procedure. I suppose statistics in the UK that I'm aware of, it seems to be around 1 in every 100,000 or so. So I don't know what it is in Ireland. Even though it is a common thing to occur in Ireland as well as it is throughout the world, we don't really have statistics that I'm aware of over here. But my surgeon did say they're actually operating on about one of them a week, and the dressing clinic that I'm attending in the hospital on an ongoing basis, they're treating anywhere from 5 to 10 people on an ongoing basis for aftercare with these to follow up on. So it's not just kind of a one and done thing. It's not like you break a bone or something, and it's kind of a it's kind of a scheduled way back, and that in terms of, all right, I'll get a cast off in 6 or 7 weeks, and have a go with a bit of physiotherapy. These procedures are not like this, which also makes it difficult for employers as well if you're working. Obviously, if you're doing a desk job or what have you, which is what I do, I'm out of work at the moment. I'm just fortunate that my employer is, very understanding of the situation, and that I've obviously went through it 2 times now. We kind of know what to expect in terms of timelines. They change, so the closer you're coming to the end and to healing, that it's not like a set timeline as such. You can kind of give an indication, but everybody is different. I suppose that moves on to the next section in terms of, once you've had your surgery, is there anything that you should change? I would say yes, there's a number of different things you could change, and there's things obviously you're not going to be able to do. Dressings wise, try be careful in the shower. Don't let any of the water try to get down your back or soak through them, because it's not going to be good for your recovery. I'd also say try to change your diet as much as you can. Look, it doesn't have to be I suppose salads and all that sort of stuff all the time, and I'm like a testament to that. Like, it's not going to be easy to implement a full change in your diet, but whereas you can, try eat as much fruit and that as what you can, cereals, etc., all that stuff, anything that's high in fibre, especially in the initial stages, because your body is, especially with a full surgery, like one that's under general anaesthetic, where you've been cut open and you've got stitches, or you've been cut open and left with the wound to heal. That wound is going to need all the help that it needs, especially in the initial stages, because it's went through a trauma, as you have yourself. Then just psychologically, just make sure that if you're alone, which I hope you're not, but if you are dealing with this alone, just to make sure that you keep in contact, with friends, family, etc., on an ongoing basis, because I find with mine that pain-wise it's not so bad. It's the psychological side of it that some days you're trying to deal with, and I'd be fairly resolute myself in terms of mental fortitude, but it's something that if you have to deal with yourself, even though I have so many different family members around me, and look, I'm never kind of alone per se. It can be a struggle some days, especially as it drags on, like that. You just have to try and maintain a positive attitude, because there is a light, I suppose, at the end of the tunnel. I'd also say, you're going to need to rely on people as well around you, because if it's extensive enough that you're not back to work within a couple of weeks or back to normal life, you're going to need to bring people to bring you to and from hospital, to and from doctors, etc., all these other things, paperwork wise as well, if there's benefits available in your country, from the social perspective, then you're going to need people to run you around the place. You can only do so much online, online shopping, all that other stuff, to get groceries into the house. But so other daily things like haircuts. As you can see, I'm probably looking a bit scruffy at the moment. My hair would never be this length, but obviously we can't go down and sit in a barber's chair or for a lady, if you can't go down and get your hair done, that's another thing. Unless you have someone to come up to your house or whatever, that's not too bad, and they can do it standing up, then all good. I suppose, yeah, psychologically for me, that's the one thing that I would suggest to you, just to make sure that you're keeping in contact with people. Even if you're, you get cabin fever, even if you're like, as you start to progress and you start to move a bit easier, just make sure you're going out, even if you've pets or whatever, to let them outside or whatever, to go to the toilet or whatever it is, or that you're just walking around and you're getting out of the house, or whatever it is. I would say, like, procedures with these are getting more advanced all the time, and I think the main message is, if you haven't gone for the surgery yet, just research as much as you can. Make sure you know what you're dealing with to as much of an extent as what you can, just so you can prepare for it. It's not like you're going to be able to move around, like, especially after a major surgery, depending on how bad your cyst or your sinus is. These can track off in different areas as well. They can branch out if they're left too long. I left mine a while, but not knowing what it was. Look, if I knew back then what I know now, I would have been straight down there. Do I think it would have changed the trajectory of the procedures that I've had? Possibly not. With mine, I was fortunate that it was one direction. It was going vertically, just from the tailbone down, and it was high enough up. So with some of these, I know they can go quite down near the, that area down there. And those ones are probably even worse. So with mine, it was quite high up the tailbone, but they did take out a lot this time. The first time they just made an incision, like I said, and that's kind of one of the two of the common procedures. But this time they just basically went in and cut out a lot of an area there. I believe it was over a centimetre deep, around 10 to 12 centimetres long. And I think when it was first come out, it was about 4 or 5 centimetres wide. 1 centimetre deep doesn't seem like a lot, but I think that actually went even deeper than that again, just to make sure that, as they said, they knew exactly what they were dealing with. So, like, these guys are, surgeons and that all around the world are well read up on this. My surgeon in particular had said that, they are a nightmare for a surgeon, because, they're just so hard to deal with. They're troublesome to the patient as well in terms of recovery, and just in terms of aftercare as well. So I suppose your aftercare as well, just, if you're changing dressings at home, or your local health centre nurse is changing them, or you're going to the hospital, which is what I'm doing, they're looking after my aftercare each week. Just be aware that that's going to be a part of your life for a period of time. Now, if your operation wasn't too bad, that's great, and you got back to normal life, or it's not overly bad, then you'll only take a very small amount of time in comparison to those people like myself that have extensive sinuses that need to be removed. It's no joke, like, it's serious stuff. But like I said, psychologically, just make sure you're getting a good keel there. Vitamins as well can help. Like, and to be honest with you, like, I wouldn't, with vitamins, like, I wouldn't believe, that they could help so much, but they have been proven to. So, like, I can give you some information about that if you wanted to contact me. Just vitamin supplements, A to Z, like any of those multivitamins. Plus, there's another, like, few, 5-in-1 multivitamins. But look, if you want to get in contact with me, I can give you the names of those that have helped. One thing that has also actually helped, and I don't really see it, any videos in regards to the pilonidal sinus or the cyst. that have shown these yet, like by somebody, is the Pico. I'll just get the thing for you now. So this little thing here is made by Smith and Nephew. You'll see that light flashing there on it. So what this is a vacuum. So we have mine left open. And even with the first one, even when I had the stitches in mine, a lot of them broke off. So what they did, in that case, it was left with an open wound when I wasn't meant to be left with an open wound. That's another, I suppose, pitfall of the primary closure technique, because if those split or the skin doesn't take them, you're left with an open wound where you should have had a closed wound. That's what happened to me as well, which complicated my first operation. But getting back to that Pico system, it's absolutely fantastic. It's what healed me the first time, really, after that happened. And it's what they have me on now. So initially, when the wound was first there was obviously too much exudate there, as in stuff coming out of the wound. So that was just packed for the first initial couple of weeks, and then they put me onto this once it stopped bleeding. What that does is a vacuum. It's a vacuum dressing. PICO is the name of it. So what that basically does is help the wound close, but it has been, lots of reviews have stated that it does actually heal them faster, versus just, if you're changing the dressings daily or whatever way you're changing them, whatever intervals. What it also does is help keep infection out, and it helps with drainage in the wound as well. So that's on now, back on. It goes on and off just depending. This wound is funny because it had been healing perfectly, without the Pico on it for a few weeks, but it tends to break down then. So what they've decided to do is kind of just leave it on for a good period of time now, just to try and bring this closed. It is healing. Like, you take pictures every week when we're in the hospital, and so do the hospital staff as well, for their own records, to go into my files just to see how progress is going. I'd say that, the aftercare, like I said, if you're looking after yourself at home or somebody's changing your dressings for you at home, all well and good, but just be aware that if your wound is extensive, it's going to need a lot of aftercare. I suppose there's lots more different information out there, but I just wanted to make something on it. Just look, I know it's an extensive area. Lots of people are going through it. It's probably not covered enough, I don't think, on YouTube in terms of people and their stories about it. For obvious reason, like, it's not anything glamorous. It's far from glamorous. But it also needs to be, like, educational. So, the more people that know about it, it might help somebody down the line. Just be aware of it. The risk factors if you're going through this, or you're about to go through the operations. If you're sitting for long periods of time, it can happen from injuries as well, I've heard. People that have lots of body hair tend, and darker body hair as well. Men, obviously more than women, and those that are aged under 40. Tends to happen to people quite young. In my case, I'm 28, so I guess it was onset about 26 or so when it started first. But it often starts younger in people. Body hair necessarily doesn't mean that it is going to happen. Like, it can happen to people with no body hair as such. Like, it could be just follicles growing inside them. If that follicle can't make it outside, then it starts to grow. If you notice a lump on your lower back, especially in that midline area, you're most likely going to be in trouble. But if you catch it soon enough, like, I've heard stories of people that have, went to the doctor relatively straight away with, once they've noticed something, and the course of antibiotics had been enough to cure it, and they've never had an instance of it again in over 30 to 40 years. There's other people that I know that have went through the wound being left open after the surgery, and have healed fully and haven't had any instances in the same amount of time, over 30 or so years. So I suppose there is a light at the end of the tunnel. but it is a long road. Like, you're just gonna have to kind of, I suppose, come to terms with it in a way. You know, as easy as that might sound, there's obviously people that are here that, you know, they might have mortgages to pay and they can't afford to be out of work, or, you know, they have young kids or whatever. I suppose obviously these are other things that are going to exacerbate that. Um, I know my own thing, like, if I can work from home for the time being, standing up, um, at least as an option that I do have. My employer are flexible enough and they're understanding enough that, you know, I can't even sit down yet. I know I'm required in the office, um, ideally, but, you know, if you're sick and you're unable to sit, which is, you know, it's a basic thing, I think, and that's probably what gets people down the most. It's a basic thing you lose, and I suppose if you're independent as well and you're kind of used to going in around places and going wherever you want at whatever time you want to, then that loss of independence can be quite detrimental to people. You don't, like, from a psychological aspect, you don't want to be just making sure that your mental, you know, keep on top of your mental health. Um, you know, because I can definitely see there is stories. There are people that have fallen into depression and all that other stuff because of it, and it's quite easy to see why. You know, so I'd say just mind that aspect of it. Once you've gone for your operation, don't be trying to lie any other way except on your stomach for the time being. You know, and getting out of bed, try to get up gradually. Don't roll out of bed. Like, there's elementary stuff. You know. I suppose there's so much more I'd like to go through with it, but there will be further videos. I just wanted to add another one to it, so that I suppose even if at least one person looks at it, that they'll kind of know what to expect and what I suppose what they're kind of going to be going through. It is painful, you know, but like the first step, I suppose, is going to the doctor, getting it diagnosed, get yourself into the hospital, and once you're on the waiting list, or, you know, if you can get it done straight away, that's brilliant. In both instances, I was on a waiting list. The second time was longer than the first time, but they need to be dealt with as soon as possible. You know, because they can grow and they will continue to grow, and you don't want that going. Like, if it's only at the end of your tailbone and it needs to be taken out, and that's a much better outcome than rather than that growing, and they will continue to grow like any other hair. And if it doesn't make its way out of the body, it doesn't mean that it's going to stop growing. You know, and branching out, and that's when it starts to branch out, then you're in really bad territory there. So I suppose in one way you have to look at the positives of your diagnosis, and what the findings are from your surgery if you've went through them, so you understand exactly what's been done. Like I said, in my in my case, at least, it was, you know, just vertically going in a straight line, and it hadn't started to branch out. So in that respect, we were lucky, and we were able to see exactly where it ended. So, look, any questions, give me a message. I'm more than happy to answer them. I'll probably be doing another video as soon as it starts to heal a bit more. But it is a struggle, like, you know, if you've gone through it, you know, and if you haven't gone through it and you're about to go through it, maybe this might have helped you a little bit, maybe scared you a little bit, but hopefully it gave you some sort of insight into it. Like I said, if you want to get in contact with me about anything, I'd be more than happy to answer any more questions on it. Thank you.